Today we're diving into a topic that's incredibly important for your health, the often overlooked skin signs of diabetes. Many people associate diabetes solely with blood sugar levels, but the truth is, this condition can manifest in a variety of ways, some more visible than others. Your skin, being the largest organ in your body, can offer crucial insights into what's going on beneath the surface. Over the course of this video, we'll be exploring 12 specific skin conditions that could be potential red flags for diabetes. These signs can range from subtle changes in texture to more noticeable discoloration or even the development of sores. It's crucial to remember that this video is not a substitute for professional medical advice. If you notice any of the signs we discussed today, please don't hesitate to schedule an appointment with your doctor for a proper diagnosis and treatment plan. Now let's get started. The first skin condition we're going to discuss is called acanthosis nigricans. This condition is characterized by patches of skin that become darker and thicker, often taking on a velvety texture. While it can appear on any part of the body, acanthosis nigricans is most commonly found in areas where skin rubs together, such as the armpits, neck, groin, and even the knuckles. So what causes these changes in the skin? Acanthosis nigricans is often associated with insulin resistance. Insulin is a hormone that helps your body utilize glucose or sugar from the bloodstream for energy. When your body becomes resistant to insulin, it means that your cells aren't responding to it properly, leading to a buildup of glucose in the blood. This excess insulin circulating in the bloodstream can stimulate the overproduction of skin cells, leading to the thickening and darkening of the skin that we see in acanthosis nigricans. While this condition is more common in individuals who are overweight or obese, it can also affect people with other underlying health conditions, including certain types of cancers. Now, it's important to note that having acanthosis nigricans doesn't automatically mean you have diabetes. However, it's a strong indicator that you may have insulin resistance, which is a major risk factor for developing type 2 diabetes. Moving on to our next skin condition, we're going to discuss diabetic dermopathy. This condition, sometimes referred to as shin spots, presents as light brown or reddish-brown scaly patches on the skin. Diabetic dermopathy is harmless and doesn't usually cause any discomfort. It's believed to be related to changes in the blood vessels due to high blood sugar levels. It's more common in long-term diabetics, especially those with poor blood sugar control. Managing your diabetes effectively is crucial to prevent or slow down diabetic dermopathy. Keep your skin moisturized to reduce dryness and scaling. Consult a doctor or dermatologist for cosmetic concerns. We'll be back with more crucial skin signs of diabetes after the break. Necrobiosis lipoidica might sound intimidating, but it's a skin condition that's important to understand, especially in the context of diabetes. This condition often presents as distinct patches on your skin, and recognizing these early signs can make a significant difference. Keep in mind that while this condition is more common in people with diabetes, it doesn't mean everyone with diabetes will develop it. These patches usually start as small, raised bumps that might be reddish or brownish in color. As they progress, they tend to flatten out and take on a more yellowish or brownish hue. One of the telltale signs of necrobiosis lipoidica is the appearance of blood vessels within the patch. These blood vessels are often visible as thin red lines running through the affected area. Now, these patches typically develop on the lower legs, particularly the shins. However, in some cases, they can appear on other parts of the body as well. While necrobiosis lipoidica usually doesn't cause any pain or discomfort, it's important not to ignore it. Remember, any unusual skin changes should always be checked by a healthcare professional. Early diagnosis and proper management of both diabetes and necrobiosis lipoidica are crucial for preventing potential complications. So, if you notice any unusual patches on your skin, don't hesitate to reach out to your doctor for a thorough evaluation. Now let's delve into another skin condition linked to diabetes, eruptive xanthomatosis. This condition is characterized by small, often itchy bumps that appear on the skin. While they might seem harmless, these bumps can be a visible sign of underlying metabolic imbalances, particularly in individuals with diabetes. These bumps, medically known as xanthomas, are actually deposits of fat under the skin. They typically appear as firm, yellow or reddish-brown papules, ranging in size from a pinhead to a pea. Eruptive xanthomatosis often appears suddenly, with multiple bumps erupting over a short period. These bumps most commonly appear on the back of the hands, elbows, knees, buttocks, and feet. However, it's not uncommon for them to erupt on other parts of the body as well. While the exact cause of eruptive xanthomatosis isn't fully understood, it's strongly associated with high levels of triglycerides, a type of fat found in the blood. This condition is particularly prevalent in individuals with poorly controlled diabetes, especially type 2 diabetes. So, if you notice these small yellowish bumps on your skin, especially if you have diabetes, it's crucial to consult your healthcare provider. Let's now turn our attention to digital sclerosis, another skin manifestation that can be linked to diabetes. This condition affects the skin on the hands, causing it to become thick, tight, and less flexible. While it might not always be the most obvious sign of diabetes, recognizing these changes in your hands is crucial for early intervention. Imagine your fingers feeling stiff, as if you're wearing a pair of tight gloves that restrict your movement. That's one of the hallmark sensations of digital sclerosis. The skin on the fingers and sometimes the hands becomes taut and waxy, making it difficult to fully extend or bend your fingers. As the condition progresses, the skin on the back of your hands might develop a slightly yellowish hue and a texture reminiscent of orange peel. In some cases, you might also notice small, indented pits on the fingertips, similar to what you'd see on a thimble. While the exact cause of digital sclerosis in the context of diabetes isn't fully elucidated, it's believed to be related to changes in collagen, a protein that provides structure and support to your skin. High blood sugar levels over time can interfere with collagen production, leading to the characteristic thickening and hardening of the skin. Diabetes can manifest in some surprising ways, and one of the more unusual signs is a condition called bullosis diabeticorum. It's characterized by the appearance of blisters, often described as looking like burn blisters, on various parts of the body. These blisters tend to develop on areas like the fingers, hands, toes, and feet, and in some cases they can even appear on the legs or forearms. Now here's the thing about bullosis diabeticorum. It's not exactly a common occurrence. In fact, it's relatively rare, even among individuals living with diabetes. But when it does occur, it can be a cause for concern and should definitely be brought to the attention of a healthcare professional. The blisters themselves can range in size, sometimes appearing small and localized, while in other cases, they can be quite large and cover a significant area of skin. The good news is that these blisters are typically painless, which can make them a bit less alarming than they might initially seem. And in many cases, they tend to heal on their own, usually within a few weeks, without leaving any scars. However, even though they might not cause pain, it's essential not to dismiss them as something insignificant. Remember, any unexplained changes in your skin, especially if you have diabetes, should always be taken seriously and evaluated by a doctor. They can help determine the underlying cause and recommend the most appropriate course of action, which might involve simply monitoring the blisters or providing guidance on proper wound care to prevent infection during the healing process. Granuloma annulare, or GA, is a generally harmless skin condition. It presents as reddish or skin-colored bumps in a ring-like pattern. More common in women and children, its cause is still a mystery, sometimes linked to medications or infections, but often no specific trigger. The center of the ring is often clear or slightly depressed. GA is usually painless and doesn't cause itching or discomfort. Always consult a dermatologist for any unusual skin changes. Diabetes doesn't just affect your blood sugar levels, it can impact your entire body, including your skin. High blood sugar creates a favorable environment for bacteria and fungi to thrive, making you more susceptible to infections. Section 2. Common skin infections in diabetes. People with diabetes are prone to bacterial infections like staph, and fungal infections such as candida and athlete's foot. Early detection and treatment are crucial. Have you been experiencing persistent itching, especially on your lower legs? It might be more than just dry skin. Itchy skin, also known as pruritus, can be a surprising symptom of diabetes. High blood sugar levels can damage nerve fibers, including those responsible for transmitting sensations like touch and itch. When these nerves are impaired, they can send faulty signals to the brain, leading to a sensation of itching even when there's no obvious external cause. This type of itching is often described as a deep, relentless itch that's difficult to relieve with scratching. The itching might be worse at night, disrupting your sleep and causing further discomfort. If you're diabetic and experiencing unexplained itching, particularly in the lower extremities, it's essential to consult your doctor. Early detection and management of diabetes can help prevent further nerve damage and alleviate the itching. Remember, while itchy skin can be a sign of diabetes, it's crucial not to self-diagnose. Numerous other conditions can also cause itching, so a proper medical evaluation is necessary to determine the underlying cause. Have you noticed patches of your skin losing their color? This discoloration, known as vitiligo, can affect people of all races and ages, but research suggests a potential link between vitiligo and diabetes, particularly type 1 diabetes. Vitiligo occurs when the cells responsible for producing melanin, the pigment that gives our skin its color, are destroyed or stop functioning properly. While the exact cause of vitiligo remains unclear, it's considered an autoimmune disorder. In individuals with autoimmune diseases, the immune system mistakenly attacks the body's own cells and tissues. In the case of vitiligo, the immune system targets and destroys melanocytes, the pigment-producing cells in the skin. The link between vitiligo and diabetes might lie in the shared autoimmune component. Both conditions involve an overactive immune system that targets and damages specific cells or tissues. While not everyone with vitiligo has diabetes or vice versa, having one autoimmune disorder increases the likelihood of developing others. If you observe patches of discolored skin, it's crucial to consult a dermatologist for proper diagnosis and treatment. Early detection and management can help slow the progression of vitiligo and address any underlying medical conditions such as diabetes. Diabetic ulcers are a serious complication of diabetes, often developing on the feet as a result of nerve damage and poor circulation. These ulcers are open sores that can range in size from small to quite large and deep. What makes them particularly concerning is their slow healing process, increasing the risk of infection. One of the early signs of a diabetic ulcer is a persistent area of redness or discoloration on the foot. You might also notice swelling in the area, accompanied by pain or a feeling of warmth. As the ulcer progresses, you may observe drainage from the wound, which can range in color from clear to yellowish or even bloody. If you have diabetes, it's crucial to inspect your feet daily for any signs of ulcers or other foot problems. Look for any breaks in the skin, blisters, ingrown toenails, or areas of unusual warmth, redness, or swelling. Should you notice any of these signs, it's imperative to seek immediate medical attention. Early detection and treatment of diabetic ulcers are vital in preventing serious complications. Remember, diabetic ulcers can worsen quickly if left untreated. In severe cases, they can lead to infections that spread to the bone, a condition known as osteomyelitis. In some instances, amputation may become the only option to prevent the infection from spreading further. So, regular foot care and prompt medical attention are paramount in managing diabetic ulcers effectively. Scleroderma diabeticorum, also known as diabetic cheiroarthropathy, is a skin condition associated with diabetes that causes thickening and tightening of the skin. This typically occurs on the back of the hands and fingers, but it can also affect the forearms, upper arms, and even the back of the neck and upper back. While the exact cause of scleroderma diabeticorum is not fully understood, it's believed to be related to long-standing diabetes and poor blood sugar control. The condition is thought to develop due to changes in the collagen, a protein that provides structure and support to the skin, making it less flexible. The symptoms of scleroderma diabeticorum often develop gradually. Initially, you may notice that the skin on the back of your hands feels thicker and less supple. As the condition progresses, the skin can become tighter, making it difficult to fully extend your fingers. This stiffness can make everyday tasks like buttoning a shirt or tying shoelaces challenging. It's important to note that scleroderma diabeticorum itself is not usually painful. However, the stiffness and limited range of motion can be uncomfortable and interfere with daily activities. If you notice any changes in the texture or flexibility of your skin, especially if you have diabetes, it's essential to consult your doctor for proper diagnosis and management.